The ARTAS system has specific indications for use that include both harvesting follicles and creating recipient sites for implantation of the harvested follicles. When identifying patients for an ARTAS procedure, choose patients that have dark, straight hair and have been diagnosed with male pattern hair loss, also known as androgenic alopecia. The complete ARTAS system includes several components. The touchscreen user interface that is used to control the ARTAS system. The system cart that houses the system's hardware and robotic arm. The needle mechanism that houses the ARTAS system's high-definition vision system, consisting of light panels and 2 stereoscopic cameras. The patient chair, designed specifically for the ARTAS procedure. There are several adjustments that can be made in order to ensure patient comfort throughout the procedure. Before treating a patient with the ARTAS system, it is important to make sure the patient has realistic expectations of their future hairline and the number of grafts to be placed. The ARTAS physician will have a consultation with the patient to review and establish these expectations. Together, they will determine the best location for a new hairline, how many grafts will be harvested, and where they will be placed. Here is an example of the ideal ARTAS procedure room. The procedure room should have all necessary items for the procedure, including graft preparation workstations, a sharps container, personal protective equipment, procedure stands, hair trimmers, barrier film, and beverages, snacks, and medications for the patient. With the ARTAS system, the physician has the option to use a workflow that works best for them. They may choose to begin with harvesting the grafts, then create recipient sites. The other option, seen in this example, is to create recipient sites, followed by harvesting the grafts. ARTAS site making offers a patient benefits that can only be achieved robotically. The procedure room for site making is set up with procedure stands containing gauze, local anesthesia, a measuring probe, a platform, surgical tape, large swabs, and a spray bottle with saline. The ARTAS site making procedure utilizes 3D preoperative planning with ARTAS Hair Studio. Using ARTAS Hair Studio, the physician prescribes a customized recipient area plan for their patient. The physician will use the platform, seen here, to deliver precise and accurate incisions for the grafts to be placed in based on the ARTAS Hair Studio plan. The ARTAS system scans the scalp, assessing each hair 60 times per second, identifies the existing hairs, and then avoids those hairs while making recipient sites based on the physician prescription. This is vastly significant to patient outcome because the final hair density will be greater if the procedure adds to the current hair a patient has, rather than transecting or damaging it because it is not clearly visualized. Once site making is complete, the patient is now ready to begin the harvesting of his grafts. The procedure room is set up with procedure stands, various forceps, medications, local anesthesia, tumescent solution, the skin tensioner, tray and tool, swabs, graft coolers with petri dishes filled with a graft holding solution, and a spray bottle with saline. Once the patient is comfortably positioned in the chair and the skin tensioner is placed, graft harvesting can begin. Using the ARTAS high-definition vision system and artificial intelligence algorithms, follicles are detected and dissected at a precise direction and angle with no guesswork. Once dissection of the grafts is complete, each graft is carefully extracted using a delicate technique to protect the integrity of each one. Grafts are then kept cool in specialized cooling towers until they are ready to be implanted. Graft preparation stations are set up with easy access to all of the items needed to prepare grafts for implantation. This includes microscopes, graft coolers with petri dishes filled with a graft holding solution, a spray bottle with saline, telfa pads, forceps, a blade for trimming grafts, and a cutting board or tongue depressor and a comfortable chair for the clinician. Here, a clinician will prepare grafts under a microscope for implantation. Once the grafts are ready to be implanted, the ARTAS team uses a workstation that includes instruments for implantation. This includes forceps that are angled at 45 degrees with smooth tips, non-woven gauze, swabs, and saline spray bottles. While a team of clinicians implant the harvested follicles, the patient is relaxing comfortably. When the procedure is completed, the patient is prepared for discharge. Specific instructions are reviewed with the patient and a support person. The patient is instructed on donor and recipient site care, diet, medications, and provided the time for a post-operative appointment. At around 12 months, ARTAS patients see their new and improved hair reaching full growth.